This is Rain Leary from Clark Dental. We're just going to cover how to take mandibular dental radiographs on a cat. So we've got our Schick sensor in portrait rather than landscape. We've obviously got the cat in dorsal recumbency on a rolled up towel. It would be about this angle, and we've got a piece of gauze. It would be underneath the sensor, keeping that against the teeth, saving it flopping away. Doesn't matter if the tongue is between the sensor and the teeth, that's fine. Okay, now I'm just going to put the right box up on my screen. There we are. So what we're going to do first is take the incisors and canines. So this would be 90 degrees to the sensor. We don't want to be 90 degrees, we want to be about 70 degrees and nice and close to the incisors and canines. So I'm going to fire my Nomad now, and you'll see what we capture on screen there. So we should have a nice image of our incisors and canines. That'll come up on the screen large in a second. There you go. So incisors and canines, that's what we wanted to get. Now this premolar here is often the one that's a problem in cats. So we want to get a nice clear image of that. So the way we're going to do that is leave the sensor exactly where it is. And we're going to, so we started off at 70 degrees here. So all you would do is leave everything as it is and just go slightly over and point at that premolar and take your image. It'll come up on the screen. There you go, so you see that premolar nice and clearly there. Now the question was how to get back far enough to take the last molar. So we can do that in one of two ways. We can either push the sensor further back in the mouth, so it's just literally going back further in the mouth. And I'll just get the right box up here. So again, we go back to the start position, which was about 70 degrees. Now we're just going to come over here, probably more in the end, about like 45 degrees maybe, and just further back in the mouth. And there we are, so we caught the last molar. Now that was a little bit underexposed because I didn't fire the Nomad correctly, but let's just show you that once more. So so we should have a better exposed image this time. There we go. So you see that's the last molar there because this is the border of the canine here, going backwards. So there's the last molar. So that often is a quick and easy way of doing that. There is another way of doing it, which is to take, instead of using that bisecting angle technique that we were just using there, you take the sensor out of the animal's mouth and you put it in like this. So, and it doesn't really matter, to be honest, whether it's like that or like that. Just put it in as far as you can so that you're right up against that last molar. And if I can do this and hold in place at the same time. But basically you're just firing straight on there. You're not firing at a bisecting angle, you're just firing straight on at the sensor. Let me see if I can do that. So you're just basically firing straight on at it. So if I get the right, get a box up. So I'm not in any kind of angle, I'm just firing straight on at this sensor, nice and close. And if you look at the screen now, there's our last molar. So you see by pushing this right back and firing against it, we did get the last molar. I'll just rotate that on the screen for you. There you go. So there's the last molar. So two different ways of doing it there. You either use a bisecting angle technique and leave the sensor pointing up to the ceiling, or you put it in as you see here and you're firing straight on at it. Okay, hope that helps.